It's a picture that, we all aim to get a very good result after trabeculectomy so that we have a good bleb and a good IUD control. And this is what we kind of want to have at the end of the day. Picture on your left is the first post-operative day. You can see a very nice diffuse bleb with this, incision line which is not very prominent. And on the other right side, you have a picture which is taken 1 year later of the same patient. This kind of result is possible, but it's a little difficult to get, and you need a lot of patience and a little bit of luck to get that kind of result. But there are a number of factors which can actually influence the outcome of trabeculectomy, and in this instruction course, the objective basically is to discuss various factors that help improve outcomes in trabeculectomy, basically aimed at increasing how we can get better success without surgery, and also how to avoid and manage if we run into complications or in difficult situations. The faculty for today's program is all well-known glaucoma surgeons. Dr. Vinay Nagi is director of Suraj Eye Institute at Nagpur, and he has done commendable work in the field of glaucoma in the community and also in an institution-based settings. He also interested in retina and also does a lot of cadet work. Dr. Sushmita is my colleague at PGI Chandigarh. She's associate professor there and has been in this field for over a decade now. She is currently recognized for her work in pediatric glaucoma, so probably you'll be hearing more about that in other form. Dr. Sristi helps me in the glaucoma clinic, and he has been in the clinic now for 5 years. So all of us, our speakers, are quite experienced in glaucoma surgery. Parul did her training with us, and then she went to Philadelphia and worked with our speak for 2 years. So before she came back and joined Government Medical College Chandigarh, and she is now practicing, and Sabine is training with us. So we have all the faculty who are well versed in the subject, and they are actually masters in their own field. The plan of action today is that we'll start with some very basics and then we build on that. So we'll start with the indications and pre-op considerations where the surgery is required. Then somewhat take you back to the anatomical stuff, and then how the tissue reacts to the injury, because surgery is an injury that we are inducing intentionally. So how the tissue heals and reacts to it, that's very important. For the outcome of surgery, understanding that it is actually very important. Doing surgery is important, but understanding that is equally important, because a lot of things go wrong after the surgery rather than during the surgery. And of course, you have to know what you're doing, so I'll take you through the steps of glaucoma surgery, the trabeculectomy surgery, and also what to do if you run into some trouble. Dr. Nagia is there, who is going to help us with that. And of course, to getting the optimum result is not just the surgery, as mentioned earlier. You have to do a lot in the post-operative period, and Dr. Srishti is going to highlight us on that. So with this, I request Dr. Srishti to start the program with his indications and pre-operative program.